Hi everybody, welcome to our education series. Today we will be discussing about the most common heard dental procedure and discuss in detail about all the doubts regarding root canal treatment. Have you ever had a toothache so bad that it kept you awake at night? Many people think that removing the tooth is the only option. But the truth is that your natural tooth can be saved with a procedure called a root canal treatment. Let's clear the myths and understand why RCT is often the best solution. Now, a root canal treatment is a dental procedure that removes infection from inside the tooth. Every tooth has a soft core called the pulp, and the pulp contains nerves and blood vessels. When this pulp gets infected due to deep cavities or cracks or trauma, it causes a severe infection. Now, what does root canal do? It treats the tooth, it cleans out all the infection, and it disinfects the tooth and seals it. So you can continue with your natural tooth for many years. Now, what are the causes and risk factors? The most common cause is deep cavities. The other causes can be cracks from biting hard food, people with poor oral hygiene, high sugar intake, or gum diseases. These risk factors can pose an individual for a higher chances of getting a root canal treatment. Now, what are the symptoms and warning signs? How do you know you might need a root canal? Look for these red flags. Persistent toothache, especially at night. Sensitivity to hot or cold lasting long after the stimulus is gone. Swelling and tenderness in the gums. A pimple-like bump on the gum near the tooth. These signs shouldn't be ignored because it can worsen the infection. Now, why shouldn't it be ignored? If left untreated, the infection can spread to your jawbone and can form an abscess. And this affects your overall health. Think of it like a spark. If you don't put it out, it can spread into a fire. Now, what treatment options do I have? During a root canal treatment, as I said, the infected pulp is carefully removed. Inside the tooth, it is cleaned, disinfected, and filled with a special filling material. Later, we place a crown on the top for protection. Now, with modern technology, anesthesia, the procedure is absolutely painless, far less painful than living with an infection. What are the prevention ways and what are my takeaway points? Now, to avoid needing an RCT, we need to brush twice daily with fluoride toothpaste and floss regularly. We need to avoid excess sugar and visit our dentist every 6 months. Remember, early detection is always easier and more cost effective than advanced treatment. So next time you hear about a root canal, don't panic. Think of it as your tooth's second chance at life. If you still have questions or concerns about root canal treatment, or if experiencing any of the symptoms I mentioned, don't wait until it gets worse. You're always welcome to visit us at Dentethix Smile Studio. My team and I are here to guide you, answer all your doubts, and provide you with gentle, evidence-based care. Remember, saving your tooth is always the best option, and we are here to help you do just that. Thank you.